With all of that said, welcome to the Clinical Athlete Journal Club meeting number 3. My name is Quinn Hennick, and I'm a proud clinical athlete provider, and I'm joined by Kevin McNamara, a recent physical therapy school grad, clinical athlete forum member, and the one responsible for bringing the Journal Club to life. He's going to help facilitate the discussion as always, so thanks for being on, Kevin.
Of course, Quinn, thanks for having me. Honor and a pleasure.
Yeah, it's going to be a good one tonight. Tonight's Journal Club topic is manual therapy, and we're just going to have it be an open discussion. We'll use the papers to guide our talking points, but the discussion, wherever it leads, and I'm really looking forward to this one. I've made a few poll questions to get a feel for the type of crew we have tonight. So the first poll question is the same one that we always use, which is, who are you? You should see that pop up. I'll give you 10 or 15 seconds to answer that. So student clinician, student coach trainer, a clinician, or coach trainer. Give you another 10 seconds or so. Looks like 52% student clinician, 55%, 10 more seconds. And cool. So 55% student clinician, 36% clinician, 9% coach trainer. Okay, sweet. And then the next question, if you are a clinician, do you utilize manual therapy? So this is only for the clinicians in the group. And about 90% yes. Okay, cool. So in some form or fashion, most of the clinicians in the group use manual therapy, and I'm sure we'll talk about the specifics there. And then lastly, if you're a student healthcare provider, do you plan to use manual therapy? And this is a very general question. We can get into what's manual therapy, but just in general. Cool, looks like about the same split, 92% plan to, in some capacity, utilize manual therapy. Sweet. And lastly, remember our motto. These meetings are conducted in the sincere spirit of inquiry after truth, without fondness of dispute or desire of victory. And for tonight's meeting, I want to highlight the without fondness of dispute, because I think some people might mistake that as saying, oh, well, we don't want dispute, or we don't want discussion or disagreement. But that's not what that's saying. It's just saying that we don't want to come in with an attitude of, oh, I'm going to win this dispute, this debate. I'm going to change people's minds tonight. But we're all here to learn and to discuss these things. And tonight's topic, I expect some disagreement, and I hope that there is, because I think that's really going to lend itself to some great discussion. So I'm going to start it off, and the 4 papers that we wanted to talk about, you might have noticed that the author crew is very similar. Joel Bialowski is the lead author on all 4 of these papers, and Mark Bishop and George are authors on 2 out of the 3, Steve George. So ideally we would have got papers from different author groups, but I think that these 4 were really good to start off with, because they give kind of an unbiased framework to some extent. We wanted to pick papers that didn't show pro or con manual therapy as far as outcomes. We wanted to pick papers that were just generally explaining proposed mechanisms and explaining why these things may work and why they may not. And I'll just talk about my current use of these things, and then I want to jump the discussion off to you guys, because I don't want to really influence this with what I do. And I'll preface what I'm about to say with, I'm by no means correct with what I do, and just because what I'm going to say is how I do things doesn't mean that should be how anyone else does them, and it doesn't make it any more right than what other people do. So currently, I do not utilize manual therapy in the traditional sense of how we would think about some type of manual therapy treatment, some type of deliberate technique to an area, planned technique to an area, or I've identified something that I deem would get treated with my hands in some particular way. The reason I don't utilize those techniques currently in my practice is my model is low frequency. So on average, and for about 90% of the people that I see, I'm only seeing them in person about once per month. And then over the course of the 30 days between visits, we're corresponding remotely, and I'm just making sure that things are going well, and their home exercise program and their training is going well, and everything's in line. If they need to come see me again more frequently, they certainly can, but generally I'm a low frequency model right now. And so when they are in my office, I feel that we need to spend that time with as many big rocks as we possibly can. We're reassessing things. I'm retesting some of the strength tests or some of the outcome measures that we started with in the initial eval. We're talking about the program, and we're talking about progress, and we're talking about how we're going to modify and progress and all these things. And I'm looking at their movements. We're maybe doing some newer exercises. We're going to implement those in the next 30 days. So I want to make sure I see that. That, you know, you guys know an hour will go by real fast. So I want to spend that time giving them as much tools as possible to be able to run with, you know, for the next block of time that I'm not going to see them. And I feel that if they're laying on the table for any significant amount of time, and I'm kind of working on them, providing them some type of short-term effect, that's not going to lend itself to their long-term goals. So that's in a nutshell why I don't utilize manual therapy in the traditional sense currently. I do, however, still put my hands, I'm still very hands-on in the sense, in a literal sense, but also kind of a figurative sense. Even if they're just doing exercises, I'm cueing, I'm kind of, you know, I'm there. And so I respect what we talked, you know, Joel's couple papers here in the placebo papers as well, just the power of therapeutic touch and kind of the theatrics that surround that. I think you can get those effects with exercise. And I still do like passive range of motion of the joints, so passive testing and things like that, largely because I still respect the power of touch and the power of, oh, this medical provider he's got my shoulder, he knows what he's doing, I feel safe, you know, in this realm. And so I'm still doing hands-on things, and some would consider that manual therapy. Would probably get the same amount of or similar effects. So I'm going to stop there because I want to see where this conversation goes, but that's my general thought process currently. Kevin, I know that you're not treating right now. You still have to, you just graduated, you're going to take the boards, but what are your overall thoughts, or how do you plan to practice as a new grad? Do you plan to utilize manual therapy?
Yeah, so I mean, obviously, take everything that I say with a pretty much a lot of salt. Just because in some ways I think that I don't have the experience to necessarily have an all-encompassing opinion surrounding the topic. But I do think what I can speak to is a little bit of the evidence, and I would say that the evidence as a whole definitely suggests that there is an effect related to manual therapy, but I would say that they're relatively small, and it's probably still up to debate how clinically meaningful they actually are. They are transient in nature, and in the cases where we do see a positive effect, I think we still don't exactly know why or how we're seeing some of those positive changes in objective measures. So, you know, I probably will utilize it in the future in a similar fashion to yourself. But for me personally, I would rather utilize interventions that have, I guess you could call it, more scientific certainty, just because I think that interventions of that nature with specific documented effects are probably more deserving of implementation and really just probably provide a little bit better of a return on investment in terms of the patient's time, the patient's dollar, et cetera, et cetera. That's kind of where I'm at with it. I've had exposure to a number of different types of manual therapy. I do think it still has a place, and it certainly can have a positive return in any number of conditions. That's just kind of my general stance on it currently, given what experience I've had thus far and my current knowledge set.
Thanks for sharing that. So guys, we'll throw it to you now. Um, either chime in, unmute yourself, or chime right in, or raise your digital hand. Isaac's got a question here. Do you think you would have a different approach if you worked with a different patient population? And that's something that I think about a lot, and it's a question that I get a lot. And I have worked in different settings. So I've not only ever been, inside of a weightlifting gym. I've worked in more traditional outpatient settings and within the insurance model. So I've been there. I do understand the argument, and but I also think that mechanisms work the same no matter the patient population. And I actually think, let's say a completely different population. Let's say Medicare, mostly chronic pain, mostly Medicare, mostly not active people and people who have no interest in being active. The population I'm kind of talking about, where they come in the door and they expect to just get passive treatment. That's what they're coming to therapy for. And I don't think there's much evidence to support the use of prolonged bouts of manual therapy for a population with chronic pain. I think, if anything, the literature supports manual therapy better with acute pain. And so I don't know currently, I don't know if my approach would be much different. My patient population, many of them still get manual therapy. They just don't get it from me. They go to a massage therapist or even another physical therapist, and they get their manual treatment. They just know that that's not what I'm going to provide. We're going to do different things, and I'm totally cool with them doing those other things, by the way, as long as the expectation isn't that those things are going to be the fix, because that's probably not the realistic view of things. Even in these papers, they talk about the effects being short term. So we have the conversations. We say, I tell them, I'm totally fine with you getting these other treatments, as long as you're incorporating the things that we're going to be doing, which are usually more, goal oriented in regards to their specific physical goals. So I can't say, Isaac, that my approach would be different right now, just based on like a different population. But I'd have to think about it, because it's a good question. It's possible. What else you guys got? We want to hear from somebody who utilizes more than me, or what Kevin plans to, because we're not right or wrong in this sense. So shoot your questions or raise your digital hand. Oh, okay, here we go. 1 second, sorry. Technology. Kelly, did you have some thoughts?
Yeah, can you hear me?
Yes.
Okay, I'm walking, so I apologize if there's loud cars going by.
Okay.
And if I sound out of breath. So I'm a massage therapist, have been for 13 years, and I'm also a chiropractor. So it's obviously something that I've done for a while, but also degrees in exercise science and all that stuff, and firmly believe in exercise. And I think part of the reason, like especially for massage, I don't take insurance, so I'm just kind of like, okay, whatever, it makes you feel good. I don't feed them like any bullshit narratives or anything like that. I do try to correct any that they may have. But in talking with like longtime massage clients, as I learn this stuff, like what's actually going on here and what's not, they don't care. They're like, I don't care, it makes me feel better. Do it anyway. I'm like, okay, like, I mean, you're paying me cash, so I guess, like, fine, as long as you don't think I'm magic, which they do. I tell them all the time that I'm not. Yeah, and it's a difficult, I do find it difficult because one of my exercise science degrees is a PhD, so I'm very much into the science part of things, and I have a little bit of internal battles all the time, because you can see people who rely on it, especially chiropractic, need to come in every month for their adjustment and all that sort of stuff. And so it's an interesting balance. And I question myself all the time. I ask other people's opinions. I don't feel like sometimes I have a great answer of why to do it and why not to do it right now, but that's just kind of where I'm at.
Thank you for sharing that. RJ, you are unmuted.
Can you hear me?
Yes.
Hey, so I'm a chiropractor as well in Michigan, and in school I did the whole well-known manual therapy overpriced program called ART, active release techniques, and just one of the many obviously manual therapies out there. And that was something that was kind of drilled in, like, oh, ART is like the shit, that's the way you got to use, and you do this and you mix in some exercise and chiropractic, there you go. And that seemed kind of like the model, but really found out as education, or as practice and education came along, that it really wasn't necessary, and it was a lot of just feeding what people thought they need. And now I would rather not use it at all, and I try not to. And using some motivational interviewing, I try and understand where the person's at and what they want. And if I can meet them and say, hey, I know you've had this stuff before, but you're also telling me it didn't work for you, so why are you here now? And so we can change that narrative of like, hey, I'm just going to treat you into let's figure this out. And a lot of times I can get that person away from wanting that stuff and just trusting me into being there for them and getting them the results that they're looking for, not needing the unnecessary fluff, even though I let them know ahead of time, like, hey, look, this is not going to be a spa-like experience. This might suck a little bit before it gets better. And I found that that's worked really well. And then other times it's more difficult, where I have to use the manual therapy stuff as a way to kind of meet that person halfway, because my thought is, if I don't use it, I'm going to lose that person altogether, and I can't help them at all, and I'm going to lose them to the system. So I at least have to use that as a way to kind of slowly gain their trust and veer them away from it. So that's kind of been my candid experience thus far.
And do you, because the theme of the conversation could make it seem like manual therapy is bad. So, but we don't necessarily think that's what we're saying. I think we're saying that it's just about shifting the expectation of what it's doing and what it's not. So when you get those patients in, and if I don't give them a little bit of what they want now, they're going to go somewhere else, to somebody who's probably going to put them in the, like you said, in the system, and they're going to be a patient for life. See you once a week for the next forever. But if you pay for 60 sessions up front, it's 30% off or some shit like that. So yeah. So your point is, as give them that little taste, and within the time now that I have with them, we can start to work on those narratives a little bit and try to find some things that are going to affect their long-term goals a little bit better. Is that kind of where you're going with it?
100%. Yeah. And I'm not saying manual therapy is bad either. I'm just saying I'm using it in a different way than I had before, where a lot of people have the misconception that like manual therapy is they're being fixed. Like, hey, can you fix this? I'm, insinuating they're broken, which you've all heard before. Instead, I'm trying to change the narrative here and kind of reconstruct their thoughts about what's going on, and create a little bit more awareness and understanding, education of their problem, and that, hey, you're not broken. We just need to get you moving in the right direction, and then help them understand why, and create a little bit of what's the word? I guess independence regarding it, meaning that, hey, you have the power to correct this and get this better, and also keep it that way too, by going through this process and understanding this problem. You don't need someone to constantly repair you and put you back together.